Chest pain. Introduction. Sam has chest pain. He lies down and rests, but the pain is still very severe and does not go away. Is this more likely to be angina than a heart attack? Select yes or no. Correct. It is more likely to be caused by a heart attack or other serious problem. Sam should seek emergency medical attention. Chest pain caused by a lung problem often gets worse when you breathe deeply, cough, or sneeze. Select true or false. Correct. Which of the following digestive problems may cause chest pain? Choose one of the following options. 1. Heartburn. 2. Swallowing disorders. 3. Problems with the gallbladder or pancreas. 4. All of the above. Correct. People who experience symptoms of a panic attack may feel like they are having a heart attack. Select true or false. Correct. Panic attacks may cause symptoms that are similar to those of a heart attack. When should you seek emergency medical attention due to chest pain? Choose one of the following options. 1. If the chest pain is new or different. 2. If the chest pain lasts longer than 2 to 3 minutes. 3. If the chest pain leaves and then returns. 4. All of the above. Correct. You should always treat chest pain seriously, even if it doesn't feel like a heart attack. It is better to be safe and be checked by a healthcare provider.
Thank you for using Explain.